uh, to all the viewers. My name is Dr. Kirti Bushan. I'm a senior consultant surgical oncologist in SL Regia Fortis Hospital, Mahim West, Mumbai. As part of continuation of our lung cancer awareness week, so today my topic is prevention of lung cancer. All of us know that cancer is a major health burden worldwide. About 13% of all new cancer cases annually and 18% of all the cancer deaths annually worldwide are caused by lung cancer. So about 1.8 million people they die of lung cancer every year. This is the recent Globocan 2020 data. As far as India is concerned, about 7% of all the new cancer cases and 10% of all the cancer deaths are caused by lung cancers. In India, the incidence is increasing as we see in ICMR registries of the metropolitan cities like Delhi, Bangalore, Chennai. The incidence is increasing in northeastern part, especially Mizoram as well. Predominantly in India, there are two varieties of lung cancers that we encounter. One is the non-small cell lung cancer, which is the most commonest variety, and other in 10 to 20% cases, it's the small cell cancer variety. These are the histopathological types. Now, predominant main commonest histopathological non-small cell cancers are the squamous cell cancers and the adenocarcinomas. The squamous cell carcinoma is the most commonest histopathological type, but at the same time, we are seeing that the incidence of adenocarcinoma is increasing, especially non-smokers, females, and with the advent of filtered cigarettes. So, if you see worldwide, in spite of the treatment for all the stages, the 5-year survival rate in developed countries is 15%, and it is only 5% in developing countries like India and other Asian countries. So, very dismal prognosis, very pathetic prognosis. What does this mean? This means that lung cancer is a biologically aggressive disease. Even an early stage disease can have a bad prognosis, and advanced stages, anyways, are going to have a bad prognosis. So, this means that we should adopt certain dietary lifestyle changes. We should change our dynamics of life so that and attain certain things so that we will be able to prevent this lung cancer from occurring inside our body. So that's why prevention of lung cancer becomes very important. Now, if we want to prevent the lung cancer from occurring inside our body, we should follow. There are 10 to 12 tips that we should follow. One is that we have to quit smoking, avoid secondhand smoke. Our houses should be free of radon gas. We should avoid occupational exposure. We should avoid radiation exposure. We should avoid air pollution. We should know our genetic makeup, family history very well. We should avoid alcohol use, and we should do proper screening if we are at risk anywhere, and dietary modifications, and above all exercise. Avoid the sedentary life habits. Now, following all these tips, we will be able to prevent our lung cancer from occurring inside our body. Coming to the first point is that avoid smoking. Smoking, as we all know, is the commonest cause of lung cancer, and about the smoking has a proved history, and it has been proved that there are carcinogens within the tobacco smoke, which when they go inside your lungs, they can lead to lung cancer. That's why it's also known as a smoker's disease. So smoking has to be So we must quit smoking. And it has been, studies have shown that if you quit smoking, there is for at least 10 years, the risk of getting lung cancer, it decreases by 50%. So we have to avoid smoking. At the same time, the most important thing is that if some elderly in a family smokes, the children, they may follow the same trend, and by the time they reach in their late 30s, 40s, or 50s, they start developing this lung cancer. So we have to act very fast in our family. We have to lead by an example. We have to educate our children that smoking is injurious to the health, and we have to engage with our children. We have to see what are their, who else are their friend circle, what are their habits, how our child is behaving in a school, and what are his extracurricular activities. So we should start it from family itself. We have to lead by example by not smoking. We have to educate our children also, so that they will not have lung cancer in their future. Those who are very chronic smokers, they can go for a de-addiction. There are various medications, various sessions available, where mentally, physically, emotionally, psychologically, they can build you, and so that you will have that courage and determination to quit smoking. Apart from that, you can, if you at all need medicines, so there are various medications with which you can relieve your addiction, and there are various other alternatives like nicotine replacement therapies, etc., which you can follow. Second important thing is that we must avoid secondhand smoke. Now, those who think that lung cancer is the cancer of smokers, they are fools, because even secondhand smoke which we inhale, if any of our friend is smoker or anyone in the family member is smoking, that smoke, if it goes inside your lung, it can cause lung cancer. And mind you, studies have shown that those who are passive smokers, those they have 20 to 30% increased risk as compared to the general population for having a lung cancer. So you must avoid people who smoke. You must refrain these people from smoking in your house. You should keep children away from secondhand smoke. You should prefer tobacco free areas of, whether it is a hotel, whether it's a restaurant, or whether it's a bar. You have to prefer a tobacco free zones. So avoid smoking, and apart from that, you should avoid secondhand smoke as well. Another important thing is that you should check your home for radon gas. Radon is a very radioactive material which does not smell, which you cannot see, but it is present in rocks, bricks, and in the soil, and it is produced by the degeneration of the uranium within the soil and rocks, and it can seep into the waters, it can seep through the bricks, rocks, or cracks within the house, and we may be exposed to radon. Studies have shown that after tobacco, the radon gas exposure is the second commonest cause of lung cancer. So we have to check our homes for radon gas as well. Now, another important thing is that you must know your family history. Any person who in the family has elders or even first degree relatives or second degree relatives suffering from lung cancer or any other cancer, they must always be cautious that they may also be genetically prone for this disease, and get themselves screened at an appropriate age. Or they must also see whether if after age of 40 or 50, if they are having certain signs and symptoms of lung cancer, they must immediately go and get themselves checked. Now, what are the signs of and symptoms of a lung cancer? Patient can have cough, patient can have difficulty in breathing, that is dyspnea, patient can have sputum in the blood, patient can have loss of weight, loss of appetite. There may be signs of metastasis. if the lung cancer has gone to other parts of the body. Suppose if it has gone to the bones, patient can have bone pain, patient can have backache, or if it has gone to the liver, there may be obstructive, then it can present with jaundice or abnormal liver functions. Now, locally, if it has gone into the nodes within the chest, they may get enlarged, they may press the major vessels that are coming out from the heart, they may cause compression, and there may be face swelling, neck swelling, they can be late stage, there can be a syndrome that is superior vena cava syndrome. Then again, constitutional symptoms like loss of weight and loss of appetite can also be there. So any person who has a family history of cancer, they must get themselves screened after the age of 40 or 50. And if they have these signs and symptoms, then they can consult their nearby physician and get themselves checked to rule out cancer within the lungs. Another important thing is the occupational exposure. Now, people who are working in mills, mines, who are working in shipyards, textile industries, and fumes from coke and coal gasification, these are the subsets of the person. They may be more prone because they are exposed to certain chemicals which are type 1 carcinogens, which have increased risk for lung cancer when they enter into our respiratory system. Arsenic, benzene, cadmium, nickel, asbestos, soot, radon. So the risk varies by the type and duration of the carcinogens. Asbestos has 14% risk, and the risk increases every year. So all the employees or all the personnel who are in certain type of occupation and who are working, they must themselves follow a proper protective measures like masks, face shields. Their duration of working has to be in a very limited manner, and after that they can do a serial chest x-rays to rule out whether there is certain abnormalities in their body. They can nebulize themselves, do a sort of breathing exercises and steam inhalation before and after going into the work. So these are the things they may protect themselves from the dust or whatever the chemicals that are going inside their body. Another important thing is the environmental pollution. We must not forget the air pollution that we create by automobiles, by a lot of smoke that we generate by burning our household things. So these all can be very detrimental because they can cause inflammation inside your lungs, and that may lead to a cancer. So we must avoid air pollution, we must plant more trees, and we must maintain greenery all around our body. Another important thing is the radiation exposure. So radiation is given as a part of treatment for cancer patients. That is one. We have seen that after 15 to 20 years, if the patient survives, if there is a radiation to the chest, there have been incidents of lung cancers or underlying malignancies also, which are radiation induced. So radiation can cause cancer. Now routinely people are exposed to radiations by when they do a CT scan or a PET scan. Now the idea here is that their value is more rather than causing any rather than the risk of causing cancer. The benefit of these investigations are more, but we have to be very judicious when we use these radiological investigations. One CT scan is equal to 400 X-rays. So see how much of radiation exposure you get. So we must remember that whenever we are evaluating ourselves and we have to use the radiological investigations, we have to be very judicious. They should change our line of treatment. If they are not helpful in changing your line of treatment, then they become unnecessary. We do not need them and we should avoid them. Another important thing is that we should avoid or limit alcohol. Now, alcohol in moderate amounts has been shown not to cause any cancer in anybody. Recent investigations have shown, but excess of alcohol is a risk factor because first, it can cause direct damage by the chemicals. Second thing is that especially in smokers who take alcohol also, it may accentuate the damage caused by the tobacco. So we have to limit alcohol intake. Regular exercises, those who regularly exercise, they decrease their risk by 20 to 30%. So 5 days a week, 30 to 40 minutes brisk walk is very essential. Now what exercise does is that it removes all the chemicals inside your body. Through the exhalation you can exhale toxins. Second thing is that it builds your immunity also, and a third important thing is that it reduces inflammation within your lungs. So exercises are very important. Then the 10th important point is that we must follow a very proper diet, a diet that is rich in fruits, vegetables. They decrease the risk at least by 5% in smokers and 5% in non-smokers as well. So eat a healthy and balanced diet which is rich in antioxidants. You can have apples, broccoli, chicken, garlic, onion, spinach, cauliflower, cabbage, turnip, green tea. They all have been shown to decrease. They contain certain good factors antioxidants that help in reducing the risk of lung cancer inside our body. The 11th important point is that we should be cautious about supplements. Now supplements has become just a normal thing. Everybody, one or the other, is taking supplements. We should be very cautious, we should be very judicious in taking the supplements. They can have a detrimental effect on your body as well, and they may accentuate certain carcinogen process inside your body. So if the recommendation is that if you have a particular deficiency, then you can take a supplement for that. But if you don't have a particular deficiency, then you should believe in natural things. Take your food, take your proper diet, consult a proper dietitian so as to overcome your weakness or any dietary deficiency you have. The 12th important point is that you should screening. Screening is very important, especially if there is a family history of cancer. The another important thing is that if anybody is a chronic smoker, has been a chronic smoker, 20 packs per year, so they are labeled as chronic smokers, or if there is an occupational exposure, people with an occupational exposure. These are the subset of candidates who after the age of 40 or 50, at least they should go for a screening, a routine chest x-ray or a low dose contrast CT scan can give us information whether or not a person is having any abnormality within the lungs. Now the cautious in our country is that our country has pollution, our country has increased tuberculosis also. So there may be a lot of pre-existing changes within the lungs that may mimic a cancer. There's where the proper radiologist, proper interpretation of the things is very important. Otherwise, false positive rates are very high. You may not have cancer, but you may do all the things and you may be unnecessarily bothered about yourself. So screening is important, especially in high risk cancers. Otherwise, high risk patients who have increased risk of cancer, otherwise routine chest x-rays yearly or 2 yearly is sufficient as far as general population is concerned. So by following these important dietary lifestyle modifications, by avoiding certain things, being strict and disciplined in your life, and following a proper regimen and following all the important points which I have already told you, we may be able to prevent the lung cancer from occurring inside our body, because we must understand the prognosis, overall prognosis is very bad. We have done so many advances in surgery, radiation, chemotherapy, immunotherapy, but still there are a lot of studies are going on to understand the actual biological behavior and exploring more and more options so that this lung cancer will have good prognosis for all of us. So very thank you for watching us. Thank you very much.